Everyone, this is Dr. Love. Welcome back to the second segment. Today, following up with last week's segment on tension headaches, today I'll talk about a very interesting but unique condition called TMJ. What that stands for is temporomandibular joint dysfunction. It's a big word, so we're going to say TMJ, and I'm pretty sure a lot of you guys have heard it. Basically, any issue in the jaw, we call that TMJ. So what I'll go over is what it is, what are some of the causes for it, what are the symptoms and certain complaints that people have when they have a TMJ disorder, and the treatments, of course, that are available to help treat this condition. And then our lovely friend, Mr. Skeleton here, I'm just going to go over a little bit of the anatomy about what TMJ is. And then that's pretty much it. So then I will go over, first off, where TMJ is, where the joint is, and what it's composed of. So if you want to look at this diagram right here, easier to kind of see on the skull here. So the TMJ is a unique joint. It is a synovial joint, so that means it has a fluid-filled membrane, just like the ones in your knees. And it is basically a joint right in front of your ear. So it's made up the temporal bone, which is the bone on the side of the head here, and also the mandible, so the lower jaw, and they both meet and they create a joint right here. It's a hinge joint. So basically when you open your jaw and you can feel that opening right here, that's what the TMJ is composed of. And that's not all. In between, there is a articular disc, and that's in between, that slips out when you open your jaw. So the disc actually moves forward and then it goes back when you close your jaw. So that's what the TMJ is composed of. And then lastly, there are fibers that attach to this disc, and there are loose fibers that attach on the superior side, so attached to the temporal bone, and then there are tight fibers that attach to the mandible. So as you can see, there are a lot of different factors that can come into play when someone has a TMJ dysfunction. There could be an issue with the disc, and then there could be an issue with the actual fibers and the joint itself, or even the jaw or the bones. So there's definitely a lot of things that make this condition very unique. So for example, it's known as a symptom complex, again, because there are many factors that make up this joint. So there's usually not just one thing that causes TMJ, there's usually a number of different factors. 20 to 30% of adults have a TMJ dysfunction at any given time, so that's quite significant. And then the exact etiology is unknown, so what that means is that there's not one consensus of what causes TMJ. But I'll go through a few ones that I think are really important to know, and there's a lot of misinformation about there, but I'll go over a few things that we have learned from studies that are some of the factors and causes of TMJ dysfunction. Okay, so the first one, like I mentioned with this disc, it's called an anterior disc displacement. So what that means is when you open the jaw, the disc slips forward, and then either it goes back into place but not properly, or it doesn't go into place when you close your jaw at all. So either it gets stuck in the front, so it's actually getting displaced, and of course that's going to cause a lot of pain, because again, this area too, there's a lot of cranial nerves that go through here. Number one being trigeminal nerve, so there could be an issue with nerve pain because this disc is not going back into place, causing pain, and therefore that person can develop TMJ dysfunction. Okay, then we have your degenerative joint disease. Again, it's a normal joint, so just like the joints in your back, they're prone to arthritis, so that's definitely one other factor that can cause TMJ dysfunction. Bruxism is another one, so that means grinding teeth at night. A lot of dentists are familiar with TMJ dysfunction because they find a lot of their patients, they can see if they're grinding their teeth, and a lot of them have problems opening their jaw, especially when they're getting their teeth cleaned. So dentists are great in picking up TMJ and treating it as well. So definitely if you're grinding your teeth at night, also people hold a lot of stress in their upper shoulders and in their face. People with stress and anxiety, you'll find that a lot of the muscles in here, as chiropractors, when we palpate, they're very tight, and patients will tell you that at night they have trouble sleeping, or they hold a lot of stress in their jaw. So that's definitely kind of leads into the next point. Higher levels of stress, anxiety, and depression, and even decreased sleep. More people with these kind of factors will develop TMJ. So there is an emotional component to this condition, and that's something definitely that I think a lot of physicians overlook. So it's really important to ask those questions about the patient. And of course, direct trauma to the jaw is going to cause TMJ. If you have ever broken your jaw due to a sports injury or fallen directly on the face, that can definitely cause some dysfunction and pain. And then there's one interesting factor that some studies have shown to be a factor in TMJ dysfunction is for women having low estrogen levels, which causes more pain. So that's more of a biochemical issue, and that's just something I wanted to point out, which was kind of interesting. Okay, so the next thing is the signs and symptoms. First off, 90% of people will let you know that they have pain right in the joint. So it feels very tender to touch. It hurts when they open it. So that's one of the signs. The second one is decreased range of motion in the jaw. So they actually have a hard time opening the jaw. Why it really hurts, and they might even complain of having pain while they're eating, just because their jaw doesn't seem to open as wide as they want it to. Clicking in the joint for sure. One thing to note is clicking in the jaw alone is not a definitive factor or a sign. It's clicking with pain, or there's grinding noises that really hurt. So that's one of the other signs. And then other things to note as well is sometimes with TMJ, a lot of people experience headaches. So again, the tension headaches do relate to this. Some people have referral with TMJ dysfunction. They get a lot of headaches in the temporal area here. Tinnitus is ringing in the ears, can happen as well. Hearing loss if it's more severe, and then dizziness. So again, that relates to the nerves in this area that can cause these things associated with TMJ dysfunction. All right, so given all this great information, if you or anyone you know suffers from TMJ, there is a lot of tools out there and treatments available that can help to relieve the pain with TMJ dysfunction. So kind of relates to last week's topic on tension headaches. First one is definitely to relax and meditate. It's been proven to help. Again, it relates to the emotional component of TMJ to get our stress and anxiety levels to a manageable level and to bring those down. And that's definitely one of the treatments given. Again, yoga helps with that as well. Dentists, like I mentioned before, they're great at picking up TMJ, so they will prescribe occasional occlusional splints, so helping with the jaw and keeping it in place. Pain medication, of course, is there. Interesting enough, Botox is another treatment that some doctors recommend. If you tried other things, you're not getting the results you want, Botox helps because I didn't really go over this, but there are a lot of muscles that attach in the jaw that help you chew your food, and one of them is called the lateral pterygoid. So they're inside of your cheek, and they sometimes start spasming, and that causes a lot of pain in the TMJ. So Botox helps to relieve that spasm in that muscle, and sometimes people get relief from that. And then acupuncture is another one, and chiropractic of course. And the main reason for that is, like again, TMJ is a synovial joint, so adjustments help to get the motion back into that joint and release some of that pressure, and even replace that disc back if there is a disc issue in the jaw there. So definitely learn more about this condition. You guys can Google it, which is perfectly fine. You can learn more about what it's composed of, because there's a lot of different elements that I didn't go over, but just for the sake of the video length, I've kind of got to the crux of it. So find out more information, and then again, if you're interested in knowing more about what different doctors can offer in terms of treatments, definitely message me, and then I can help guide you through that. So, all right, I'll see you guys next week, and comment below and let me know what you guys think. Thanks, bye.